This model, there's a lot of different things that I could ask you on this model. So I'm going to start at the top and kind of work my way down. So this is the hyoid bone. The hyoid bone. From this structure here to here, this whole structure is called the larynx. The larynx. This gland is the thyroid gland that you see here. The thyroid gland. This is the thyroid cartilage. And this is cricoid cartilage. Once I get here, I'm at the trachea, and these in blue are the cartilaginous rings of the trachea. Here we have the hyoid bone, thyroid cartilage, cricoid cartilage, and here in the back, cricoid cartilage. This is the trachea and the cartilaginous rings of the trachea. The other side shows the thyroid gland. Posteriorly, I can see this top portion is the epiglottis, and the hole or cavity created here is the glottis. Opening the structure up, I can see the whole thing is the larynx up to here. This is the epiglottis. This is the vocal folds and vocal cords here. This is the thyroid cartilage. So this one you can see the thyroid cartilage, cricoid cartilage, and cricoid cartilage. And the other one, the cricoid cartilage here, was obscured by the gland. Okay, and then again, this whole area here is the glottis, and it has the vocal cords and vocal folds there. Here I can see a continuation of the trachea and the cartilaginous rings of the trachea. This is the heart. We can see the heart sits slightly off towards the left side. For this reason, the left lung is only going to have 2 lobes, whereas the right lung has 3. This would be the superior lobe of the left lung and the inferior lobe of the left lung. On the right lung, superior lobe of the right lung, the middle lobe of the right lung, and then here is the inferior lobe of the right lung. At the base of the lungs, you see this muscular tissue. This muscular tissue is the diaphragm, and it's the principal muscle for respiration. Here you can see a better view of the diaphragm. All right, removing the lungs exposes the heart. Underneath this structure here is going to be the right atrium. Under here is the right ventricle. Under here is the left atrium and the left ventricle. On the outside, this ear-like structure is going to be the right auricle. And similarly on the left, this is the left auricle. This vein here is going to take deoxygenated blood from the right arm. Okay, so this is the right subclavian vein. This is the right jugular vein. So the subclavian vein and jugular vein are going to merge together to form the right brachiocephalic vein. On the left side of the body, I'm going to have the left subclavian vein and the left jugular vein here. Those are going to merge together to form the left brachiocephalic vein. The right and left brachiocephalic veins are going to merge together to form the superior vena cava. The superior vena cava. Down here, I have the inferior vena cava. Also, if I were to just look at the heart itself, this is the inferior vena cava, and so is this. Deoxygenated blood from the lower portions of the body are going to enter the right atrium through the inferior vena cava. Deoxygenated blood from the upper portions of the body is going to enter the right atrium through the superior vena cava. The right atrium is here, and this is the tricuspid valve. The tricuspid valve. I have these strings that are attached to the valve, and these are called the chordae tendineae. Chordae tendineae. The chordae tendineae are attached to papillary muscles that ensure that the valve only opens in one direction and not the other. This chamber here is the right ventricle, the right ventricle. From the right ventricle, blood is going to exit the heart through the pulmonary semilunar valve here. The pulmonary semilunar valve. The pulmonary semilunar valve is going to go to the pulmonary trunk. The pulmonary trunk. Now, the pulmonary trunk is going to bifurcate or split, forming the right pulmonary artery and left pulmonary artery. Blood is going to become oxygenated and then return to the heart. How it returns to the heart is through these structures here. So these are the right pulmonary veins and left pulmonary veins. So both the right and left pulmonary veins are going to drain blood into the left atrium, which is here, the left atrium. From the left atrium, blood goes through the mitral valve or bicuspid valve. It's kind of dead here. Okay, the little strings are the chordae tendineae. So yeah, this is kind of broken, so sorry about that. So the strings are the chordae tendineae. They're attached to the papillary muscles. This chamber here is the left ventricle, the left ventricle. From there, blood is going to travel through the aortic semilunar valve. The aortic semilunar valve allows blood to leave the heart and enter into the aorta. Just this portion of the aorta that's shown here is the ascending aorta, and I can see more of the ascending aorta here. If I look very closely, I can see there's two branches that are coming off of the aorta. This is the right coronary artery, and here is the left coronary artery. The coronary arteries are going to give blood supply to the heart itself. Now that I have the heart back together, we can continue to trace the right and left coronary arteries. Here is the right coronary artery continuing. The left coronary artery in this model splits immediately. So the left coronary artery is going to split, forming the anterior interventricular artery, which is here, and the circumflex artery, which is here. If I follow the circumflex artery around, I'm going to get to this very large vein here called the coronary sinus. The coronary sinus. This also gives you a better view of that inferior vena cava as well. For blood supply going to the body in the systemic circuit, that blood's going to go up into the ascending aorta and then arrive at the aortic arch. The aortic arch has three branches that are coming off of it superiorly. This first branch is the brachiocephalic trunk. The brachiocephalic trunk. The brachiocephalic trunk is going to bifurcate or split into the right subclavian artery and the right common carotid artery. The second branch is going to be the left common carotid artery, and I can see that continuing here. The third and final branch off of the aortic arch is the left subclavian artery. The left subclavian artery. Now, if I remove the heart, I can see some additional structures here. After the ascending aorta, we have the aortic arch. After the aortic arch, it's going to turn and the aorta is going to descend as the descending aorta. I want you to be more specific though. The portion of the descending aorta that goes through the thoracic cavity is going to be the thoracic aorta. So I can see the thoracic aorta here. Once the thoracic aorta goes through the diaphragm, which I see here, it's then going to be called the abdominal aorta. The abdominal aorta, and I can see part of that here. This structure here is the esophagus. The esophagus. The esophagus is also going to travel through the diaphragm and then connect with the stomach. I can now see more of the trachea exposed. So this is the trachea. The trachea is going to bifurcate. It actually bifurcates into the right and left primary bronchi, sometimes called the main bronchi, but I think primary is a little bit more used. So that would be primary bronchi here. And because I have 3 lobes in the right lung, I'm actually going to get 3 separate secondary bronchi. So, and then the secondary bronchi are going to branch to tertiary bronchi and so on and so forth, getting to the tiny bronchioles. Now the left lung only has 2 lobes, so for that reason, the primary bronchus is just going to split off into 2 secondary bronchi here. And then I can see more branching of the bronchi. Now I've got tertiary bronchi, etc., till I get to the small, fine bronchioles.